Welcome to your community health update. Here today we have Vanita Townsend, who is a part of our community resource team. She is going to educate us today on congestive heart failure. Vanita, could you explain to us what is congestive heart failure?
Congestive heart failure is when the heart fails to pump enough blood to meet the body's demands. There are two types of heart failure. There's right-sided heart failure and left-sided heart failure. In right-sided heart failure, the blood backs up into the capillaries and the swelling is shown in the feet and in the ankles. In left-sided heart failure, the blood backs up into the lungs and the primary sign and symptom is shortness of breath.
What are some of the causes of congestive heart failure?
Some of the causes of congestive heart failure are people who are experiencing hypertension sometimes can go through congestive heart failure. Coronary artery disease is another cause of congestive heart failure. And sometimes some infections might cause congestive heart failure.
And what are some signs and symptoms of congestive heart failure?
Some signs and symptoms of congestive heart failure, once again, is shortness of breath, swelling of the feet and of the ankles, fatigue or weakness, persistent cough or wheezing, and sometimes in the cough you might exhibit some phlegm with blood tinge, white or blood tinge phlegm, rapid weight gain of about 5 to 10 pounds, irregular rapid heartbeat, change in urine production, whether it's an increase or decrease, and mainly you feel like you have to go at night, nausea, loss of appetite, and decreased alertness.
So, who are susceptible to congestive heart failure?
Any one of us can be susceptible to congestive heart failure. It all depends on what we're going through at the particular time. For instance, if you have a history of hypertension or are at this time hypertensive, you might experience some congestive heart failure. Coronary artery disease, people who are uh, experiencing coronary artery disease can also be susceptible to congestive heart failure. Um, the risk factors mainly are people who are of that nature. Some people who are diabetic, if you're obese, hypothyroidism, severe emphysema, and primarily also if you have a previous history of heart disease, you can be susceptible to congestive heart failure. And some people who are experiencing valvular heart disease also can be susceptible to congestive heart failure.
So, what is the life expectancy of a person who has congestive heart failure?
Actually, today there are 5 million Americans who are living with congestive heart failure. So the life expectancy have increased somewhat. It's like early detection, really. The quicker you um, exhibit or the quicker you notice these signs and symptoms, you can see your physician and get treated right away. I want to also add to the list of risk factors before. People who consume a lot of alcohol sometimes can experience congestive heart failure. Once again, the smoking, which can lead to severe emphysema. And believe it or not, long-term anabolic steroids use can lead up to congestive heart failure.
Okay, is there any cure for congestive heart failure?
Um, no, as the symptoms occur, they are treated based upon the symptoms also. I want to point out also that more men are affected by this disease than women. I do not know why that is, but it seems to be more susceptible in men than women.
Okay. So if I'm a person who are exhibiting these signs and symptoms of congestive heart failure, what should I do?
Well, the first thing you want to do is speak with your physician. If you are at a severe level where you feel uncomfortable in breathing, you can't catch your breath, um, you should go to the emergency room right away. I want to point out also you can reduce these risk factors for congestive heart failure. If weight is a problem, you can do so by losing excess weight, discontinue and avoid alcohol use and smoking. Eat a healthy diet, most likely a diet low in sodium. Maintain a normal blood pressure. That's why it's important to get a yearly physical and keep in touch with your physician. Decrease or discontinue, once again, any alcohol consumption. And as always, eat healthy and regular exercise. It never hurt nobody, never kill nobody, and it can help reduce your risk for congestive heart failure.
That concludes our community health update, and we thank Miss Townsend, Miss Vanita Townsend, for stopping in and educating us on congestive heart failure.